The first step is to ensure you are well prepared. Please watch the Central Line Care preparation video before you start. Gather your supplies. To heparin lock your child's central line, you will need 1 heparin syringe for each lumen of your child's central line, 3 alcohol swabs per lumen, 1 swab cap, also known as a pumpkin per lumen, and hand sanitizer. If you are planning to change the cap on your child's central line, this should be done before heparin locking. Refer to the Central Line Cap Change video now. Clean the tray or surface you will be using to set up the supplies. Wash your hands using soap and water for 1 minute. Make sure you scrub your hands well and dry them with a clean towel or a clean paper towel. Prepare the supplies on the clean work surface. Starting with the heparin, open the package and place the heparin syringe onto the work surface. Open the first alcohol swab by tearing 3 sides and opening it like a book. This way you can stack the other swabs on top of each other. Open the swab caps and keep them in the package. Add them to your tray. Sanitize or clean your hands. Pick up the heparin syringe. Keeping the cap on the heparin syringe, pull the plunger back until you feel the plunger move and hear a pop sound. Remove the cap of the heparin syringe and slowly push the plunger up to remove the air bubbles. Put the cap back on the syringe and place it back onto the work surface. If your child's central line has 2 lumens, repeat these steps with the other lumen. Look at your child's central line and make sure each lumen is clamped. If there is a swab cap, also known as a pumpkin, on the end of the lumen, remove it now. If the swab cap has stayed clean, has not been dirtied, and has been on for longer than 5 minutes, you do not have to scrub the cap. If you think the swab cap may have become dirty, for example, if it came off and was placed back on the cap, then it is important to follow the next steps and clean the cap. Using your non-dominant hand, take an alcohol swab and use it to pick up the lumen. Pick up a second alcohol swab and use it to scrub the end of the cap for 30 seconds. Remember to apply pressure to create friction. Take the last alcohol swab and clean up the lumen towards the clamp. Allow the lumen and cap to dry for 60 seconds. Make sure you do not touch the lumen or let the lumen drop, otherwise you will have to clean it again. Remove the cap off the heparin syringe and attach the heparin syringe by twisting it clockwise to the right onto the end of the cap. The amount of heparin you will use is based on your child's weight and type of line they have. Confirm the amount of heparin you will use now. Unclamp the lumen and press the plunger forward slowly until the right amount of heparin has been put into the lumen. Clamp the lumen. Remove the used heparin syringe from the cap by twisting it counterclockwise to the left. Attach a swab cap or pumpkin by pushing it on and twisting. If your child's central line has 2 lumens, repeat these steps with the other lumen. If you have any questions about heparin locking your child's line, please make sure you ask your nurse. You are all done.